Hi, this session is going to be on the integration of a Hep C Navigator to the team. So first, I'd like Emma to introduce herself.
Hi, my name is Emma Newcity. I am the Hepatitis C Navigator with Project Aware at STAR in Fall River, Massachusetts.
Thanks, Emma. So first, I'd like you to tell us a little bit about the importance of delineation of roles and responsibilities when bringing a new Hep C Navigator onto the team.
Sure. So this position was added to the agency in July 2019. And prior to that, our infectious disease Hep C team consisted of two internal providers and a Hep C nurse. We used to have a case manager many years ago, but that position no longer existed until 2019. So what was happening before we had a Hep C Navigator was the Hep C nurse was responsible for anything having to do with linkage to Hep C care and Hep C treatment. So she was getting the referrals, making the appointments, making follow-up calls, and we have a high volume, unfortunately, of Hep C patients that come through both our primary care center and my department, Project Aware, which we do HIV, Hep C, and STI testing. So with the amount of patients that we were wanting to see, it was taking a little bit longer than we would like to get people in, just because the Hep C nurse had so much on her plate. So when the idea of a Hep C Navigator was introduced, we wanted to look at what the Hep C nurse was doing that could potentially be taken over by somebody else. Nothing having to do with, anything, needing any kind of medical signatures or anything like that, just more of the navigation and short-term case management piece of it. So we sat down, myself, my supervisor, and the Hep C nurse. When I was hired, we talked about what exactly the workflow looked like in terms of getting a patient into Hep C care. And then we really broke it down step by step and said, okay, what are things that the Hep C Navigator can do that the Hep C nurse is already doing? And then additionally, what are some things that the Hep C Navigator can do to improve our services and add some things that we didn't have the capacity to do before?
Great.
Thank you, Emma. So tell us about the onboarding process and how you implemented the workflow.
So, like I said, we sat down, myself, my supervisor, and the Hep C nurse, we sat down just to come up with the workflow. And then from there, once we had, a mutual understanding of what was going to happen, then I met with both of our ID providers so that they knew who I was. And I think that was key in making sure that there was a smooth transition of tasks, just because the Hep C nurse was obviously very much involved in coming up with this new workflow. So everybody who really, really needed to be on the same page, we were right away. So I started on a Monday, and then by the end of the week, I was already getting referrals. And so we were able to implement this role really quickly. And then from there, it was really, really crucial that I met with other providers because they were the ones who are sending in the referrals for their patients. So I went to provider meetings. I met with department heads of other programs at STAR, so our MAT program, our ABH program. So I met with everybody, our detox. So I met with people so they knew that we had, one central go-to person that would handle Hep C related issues. And so it just all became way more streamlined. So everybody pretty quickly, because of those introductions, was aware that there was somebody new that could handle any Hep C patients and any Hep C questions or concerns.
That's really great. And I imagine the capacity that the nurse had increased, because I'm sure there were some things that she maybe couldn't do as regularly or maybe not at all, that once you kind of shifted some of the tasks from her plate to your plate, that opened up for her, I would imagine.
Definitely, because she's not just the Hep C nurse, so she has other responsibilities that she has. She works with other She works with the infectious disease provider who obviously doesn't just do Hep C. So she had all of the Hep C patients plus all, of the other patients. So it tends to, the referrals can at that point not be addressed as quickly as we would like, and we wouldn't get people in. And sometimes it's hard to keep people in care, so we want to get to them right away. So it definitely frees up time for the Hep C nurse. And then on my end, on the navigator's end, we identified that something that we would like to do is do check-in calls with Hep C patients to see, if they're missing any doses, any side effects, just so that we can know what's going on when they come in for their follow-up. And that was something that we would have liked to do before, and now we can, because it's not just one person handling everything. We have another set of hands to do kind of more like the administrative case management stuff on the back end. And then the nurse can focus on ordering meds and administering them and labs and stuff like that.
I'm sure the patients really appreciate another person on the team that they can connect with and know they can rely on, and have, like you said, have those check-in calls and reminders, and I'm sure that goes a long way for them as well to feel.
It definitely does. I haven't had one patient decline that service, because not everybody wants those check-in calls. Not everyone needs them. So my initial introduction to the patient, I offer that service, and if they would like it, and I haven't had a single person say no, and it's been really beneficial, because the patient isn't inclined to call us if they're missing a dose, or if they're experiencing side effects, because they have a bunch of other stuff that they need to deal with in their lives. So it's helpful to reach out to the patient, because then we get information that we might not have had before. They might have shown up to their follow-up appointment and said, "Hey, I missed 4 days of medication," and then we have to evaluate it from there. Whereas if I knew that beforehand, I can communicate that to the Hep C nurse and the providers, and so we have a better idea of what to do.
Well, that's great. You've clearly demonstrated the importance of the Hep C Navigator on the team, and kudos to you and the good work that you're doing. And we really appreciate you taking the time to speak with us this afternoon. Thank you.
Thank you.